You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, mother of four, not three. Actually, my fourth is nearly 8 months old at this time, so been a mom of four for a while, and also a teratogen information specialist. So as a teratogen information specialist, I talk with people about exposures during pregnancy and breastfeeding, also pre-pregnancy and in cases of adoption. And exposures can be anything. So things like medications, environmental exposures, alcohol, or in some cases, even illness. And that's what we're going to be talking about today, a very specific condition called cholestasis of pregnancy. So we will be talking to a caller who has some questions about this condition in pregnancy. And we also have our special guest expert. So this is a return guest, someone we've had on the cast before. It's Alfred Romeo from Mother to Baby, Utah. Al, how are you today?
I'm doing well. Thank you for having me on again. Happy to talk about this topic with you.
We are so happy to have you back. Thank you. So for those of you who may not know, Al Romeo is a registered nurse with a doctorate in health promotion and education. He is co-chair of the research committee for the Organization of Teratology Information Specialists and Mother to Baby. He has experience working as a nurse in newborn intensive care, teaching college health education classes, training medical homes in improving services for children with special health care needs, training young adults with disabilities for leadership and advocacy, helping families learn about child development. He's also a teratogen information specialist. He's an expert. He's lots of fun to talk to, and we're really, really grateful to have him back. So Al, as I'm sure you know, Mother to Baby answers questions in a lot of different ways, including answering questions on the podcast. And we love that. We love when people contact us with their questions and with their ideas for the show. So if you, any listener out there, has a question that they want to hear addressed on the show, or if you would like to be on the podcast yourself, please feel free to contact us. You can email us at contactus, all one word, at mothertobaby.org. And actually, that's how we got in contact with today's caller. She took the initiative to email us about a topic that she had some questions about. And on the phone, we have Donna. Hi, Donna. How are you doing today?
Hi, I'm doing great. Thank you.
Thanks so much for calling in. So where are you calling from?
I'm calling from Miami, Florida.
Okay, so why don't you tell us a little bit about you?
So my name is Donna Benavidas, and I'm the founder of ICP Care. And ICP Care is a wonderful nonprofit organization, and we help pregnant mothers who experience the high-risk pregnancy condition, and it's called Intrahepatic Cholestasis of Pregnancy. And we provide patient support and education and raise public awareness and support the advancement of research and improve healthcare practices. So overall, ICP Care helps anyone affected with ICP to connect, to support, and educate and empower those affected with this high-risk pregnancy condition.
Let's talk a little bit about cholestasis in pregnancy and the known effects on the baby.
Sure. As you know, moms hear us when we talk to them. Often the condition is worse than some of the medications. So this is one of those conditions where we definitely would want mom treated. It can have severe problems for a baby. So just kind of an overview of this, the intrahepatic cholestasis of pregnancy, or ICP. Now this is a problem where the bile acid doesn't pass out of the liver. So it starts to build up in the liver and then builds up in the bloodstream. And that can cause problems for the baby, a variety of different problems: preterm labor, preterm delivery, fetal distress, meconium passage. There's more details on the risk for that one. Respiratory distress, asphyxia, stillbirth. So all of these problems are really severe for babies. So it's definitely important for mom to, let provider know when she starts to have some of these symptoms. We'll talk about those, and make sure that it's treated well to protect baby more than to help mom be comfortable. We definitely want mom to be comfortable, but like I said, this can have severe problems for baby.
And that's actually something that I experienced. This is why I founded the organization. In 2003, with my first pregnancy, I was diagnosed somewhat late in my pregnancy. Nobody in my family had this, and it was somewhat rare. My doctor did have some experience with the condition. However, I unfortunately I lost my son at 37 weeks, which was a week after I was diagnosed. And so I really have been passionate about just getting the word out and just helping bring everyone together to help prevent any further infant loss.
So, Donna, I'm very sorry to hear about your loss, and I'd like to commend you for being able to turn it into something that is helpful for other families out there. So thank you for that.
Thank you.
So let's talk about symptoms. What are we looking for?
So it's very common in this condition for the itching, and that's the main symptom to be watching for. The itching to start at the hands and the feet, and it can go to other area. This itching, it isn't relieved by Benadryl, diphenhydramine, or some of the antihistamines. So, we don't want mom to be trying to self-treat that itching. It's not a rash. It's not an allergic reaction. It's those different components in the blood that aren't getting filtered out, and that's what's causing that itching, and that's what can cause the problems for baby. So mom needs to let her provider know when she has the itching, and like I said, hands and the feet is kind of an odd thing. Now, some of the other symptoms that might go along with it would be the jaundice or the yellowing of the skin. We hear about this in baby because they're not able to break down those components of the blood, but it's similar process. Mom isn't getting rid of those waste products from the blood, so that yellowing of the skin, nausea, dark urine, light stools, and pain around the liver. And the liver is on the right side, kind of tucked up underneath the rib cage. So there's a variety of symptoms depending on how severe mom has it and how it's affecting her.
Really interesting, because I know that some itching is considered somewhat common during pregnancy, especially of the palms. But I think it's interesting that you said that it's, kind of an intense itching and something that's not easily relieved in other ways. So I guess the message would be, when in doubt, contact your healthcare provider, because even if it's not that, like you mentioned, it can be so serious for a pregnancy, we don't even want to take those chances. So Donna, as someone who works so closely with people who may be currently experiencing this condition or have experienced this condition in the past, I'm sure, there are lots of questions about a lot of different things. What are some of the more common questions that you come across?
A lot of the moms on the support group will sometimes have questions regarding the medicine that's used to treat cholestasis of pregnancy, which is ursodeoxycholic acid or ursodiol, and they just have questions regarding if it has any effects on the baby.
That's a great question, Donna. Al, what can you tell us about the use of this medication in pregnancy?
So this medication, the ursodeoxycholic acid or ursodiol, helps control those bile acids that are building up in the liver, building up in the bloodstream. So it's one of those, it's similar to the chemicals that our body already produces. So it's not expected to cause any increased chance of problems in the pregnancy. Most of this is going to go to the liver, not much stays in the bloodstream. So even in breastfeeding, we're not expecting much to get into the breast milk. So it's not expected to cause any side effects for the breastfed baby either.
So Donna, do you have any other questions that commonly come up in your group?
Some of the moms do speak about Benadryl for the itching, and because itching in pregnancy is somewhat normal, they may think that they have an allergic reaction.
Okay, Al, so when we first started talking about this earlier, you did mention Benadryl and histamines. And as Donna just said, she does have women who ask her about the use of those during pregnancy. So my question to you is, what about the use of things like Benadryl in pregnancy? And is there anything else that we should consider?
Sure. So the Benadryl or diphenhydramine has been very well studied in pregnancy. no increased risk of birth defects or other problems. So it's not a problem to use Benadryl. The concern is we don't want moms self-treating for a long period of time and, missing those symptoms and not reporting them to the provider, because we definitely want her to be treated for this. So like I said, the Benadryl, not a problem for pregnancy, but don't use it to try to treat some of those odd itching, like I said, for the hands and the feet, because we don't want to miss that. There are other medications that work better for it, just because this is a problem with those waste products in the blood and in the liver. So it's not a histamine issue. It's not an allergic reaction. One of those medications that is commonly used for this is dexamethasone. Now, it's a steroid, and it helps to reduce that itching. It's also one of those medications to promote babies' lung development, so get babies that we think are going to be born prematurely ready for that preterm birth. So it's very commonly used to help moms and those babies that are going to be born prematurely. So it's not causing an increased risk of problems for the pregnancy. We don't expect any of those issues in pregnancy. And for breastfeeding, even if mom needs to continue to use it in breastfeeding, small amounts might get into the milk, but far less than an infant dose. This medication is given to infants. So that's the medication that mom might be prescribed and would want to use. And like I said, has the double benefit of helping mom with that itching and helping babies' lungs mature, being ready for that preterm delivery.
And I think that's a great point. And I know that we as information specialists always tell people, before you change how you take medications, before you start taking anything new, even something over the counter like diphenhydramine, make sure you check with your provider. And that's not because, it's not easily accessible or that, a person does not know how to use that medication. It's that if someone is going to be treated, we want to make sure that they're being treated correctly for the correct thing to minimize any risks to mom or baby.
Absolutely. We don't want to miss symptoms, and we don't want to mask symptoms, so that we're covering those up and not letting the provider know, which may be a clue to some other problem.
Excellent point. Donna, thank you so much for being on the podcast today. We got so much good information about ICP. I've certainly learned a lot, and I'm very, very grateful that you were here. Is there any last thought that you would like to leave us with?
I'd really like to thank you for your time and for sharing with your podcast listeners this important topic. And I would love for your followers to reach out if they feel itching. We have wonderful support groups. Additional information can be found on icpcare.org.
Al, before you go, are there any final thoughts you want to leave our listeners with?
Absolutely. So when mom has questions about any of the different conditions she has concerns about, or any of the different medications, get in touch with us. You can listen to these different podcasts, read our blogs, but it's always a good idea to get in contact with us. All of our contact information is out there at mothertobaby.org. We love having those telephone calls so that we can, see what's on your mind and what you're having concerns about, and we can talk through those. Sometimes it's a quick conversation and we can help you. Other times we may need to dig a little bit deeper and see what else is going on and see how we can help you. And again, it may require referring you back to your provider to make sure that you're getting all the treatment that you and baby need.
I agree. So thank you again, Al. And of course, as always, thank you to all of our listeners. We're so happy to continue to be able to bring this information to you all. And as Al said, you are free to contact Mother to Baby at any time. So we have a bunch of ways, as always. You can call us toll free at 866-626-6847. You can text us at 855-999-3525. You can email us at contactus@mothertobaby.org. And of course, our website is always available, mothertobaby.org, where we have all of our fact sheets, we have all of our phone numbers, our chance to do a live chat with our counselors as well. Lots and lots of good information, including links to other podcasts. So if this is your first podcast with us, welcome. Also, on iTunes, Spotify, however you listen to podcasts, don't forget to subscribe so you can never miss a new episode. We hope you will join us again. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.